Question 1. The primary role of an RBT, Registered Behavior Technician, is to A. Design behavior intervention plans. B. Supervise other RBTs. C. Directly implement skill acquisition and behavior reduction plans under the supervision of a BCBA or BCABA. D. Diagnose developmental disabilities. Answer: C. Directly implement skill acquisition and behavior reduction plans under the supervision of a BCBA or BCABA. This question asks about the main job of an RBT. The keyword primary role focuses on your core responsibilities. While BCBA's design plans and supervisors oversee things, the RBT's main job is hands-on, working directly with the client to put the plans into action, whether it's teaching new skills or helping reduce challenging behaviors. You don't design the plan or diagnose conditions. You follow the instructions from your supervisor. For example, if a plan says to teach a child to ask for a toy, you would follow the steps outlined in that plan. Remember, as an RBT, you are the one implementing the plan developed by the supervisor. Question 2. When a stimulus is added following a behavior, and the future probability of that behavior increases, this is called A. Negative reinforcement. B. Positive reinforcement. C. Positive punishment. D. Extinction. Answer: B. Positive reinforcement. This question is testing your understanding of reinforcement. The key phrases are stimulus is added, and the future probability of that behavior increases. Positive in ABA means adding something, and reinforcement means the behavior is more likely to happen again. So, putting them together, positive reinforcement is when you add something, and it makes the behavior stronger or more likely. For example, if a child says, "please," behavior, and you give them a cookie, adding stimulus, and they are more likely to say "please" in the future, that's positive reinforcement. Think of positive as adding and reinforcement as strengthening the behavior. Question 3. What is the RBT's responsibility regarding documentation? A. Create complex graphs and charts. B. Accurately collect and record data as instructed. C. Decide which data to collect. D. Share client information freely with anyone who asks. Answer: B. Accurately collect and record data as instructed. This question is about an RBT's role in documentation. The RBT isn't typically responsible for designing how data is analyzed or choosing what data is important overall. That's the supervisor's job. Your main responsibility is to collect the data accurately and consistently as your supervisor tells you to, whether it's counting behaviors, timing them, or marking if a skill was performed correctly. Sharing client information is definitely not allowed due to privacy rules. For instance, if the plan says to count how many times a client asks for a break, you need to diligently count and record that number exactly as you observe it. Remember, your data is crucial for the supervisor to make decisions, so be precise. Question 4. An antecedent is A. What happens immediately after a behavior? B. What happens immediately before a behavior? C. A consequence that increases behavior. D. A consequence that decreases behavior. Answer: B. What happens immediately before a behavior. This question asks for the definition of an antecedent. Think of the ABCs of behavior. Antecedent, behavior, consequence. The antecedent is the A and comes right before the B. The behavior, it's the trigger, cue, or situation that sets the stage for the behavior to occur. It's not what happens after, that's the consequence. For example, if a child sees a cookie, antecedent, they might reach for it. Behavior, or if the teacher says, "time for math." Antecedent, a student might groan. Behavior. The antecedent is simply what happens right before the action. A good way to remember is a comes before B. Antecedent before behavior. Question 5. Behavior is defined as A. Anything a person thinks or feels. B. Anything a living organism does or says that can be observed and measured. C. only challenging actions. D. Internal processes that cannot be seen by others. Answer B. Anything a living organism does or says that can be observed and measured. This question is about the definition of behavior in ABA. In ABA, behavior has a very specific meaning. It's not just about actions, but anything a person or animal does or says that someone else can see or hear and count. Thoughts and feelings are internal and can't be directly observed by another person, so they aren't considered behavior in this technical sense. Challenging actions are just one type of behavior, not the only type. For example, raising your hand, saying hello, walking, or even sitting still are all behaviors if they can be seen or heard. The key is that it's something observable and measurable. Question 6. Which of the following is an example of discontinuous measurement? A. Recording every instance of a behavior. B. Measuring how long a behavior occurs. C. Taking data on a behavior only during specific intervals or at specific moments. D. Counting the total number of times a behavior happens. Answer. C. Taking data on a behavior only during specific intervals or at specific moments. This question is asking about discontinuous measurement. Unlike continuous measurement, like counting every time a behavior happens or timing its duration, discontinuous measurement doesn't record every single instance. Instead, you might check if the behavior happened during a short time interval recording, or at the very end of an interval, momentary time sampling. This is often used for behaviors that happen constantly or are hard to count every single time. For example, if you're tracking how often a student is out of their seat, you might check only every 5 minutes instead of watching constantly. It's called discontinuous because you aren't watching and recording all the time, just at specific points. Question 7. What is the purpose of an RBT supervision requirement? A. To make sure RBTs are following ethical guidelines and implementing procedures correctly. B. To give the supervisor extra work. C. To allow the RBT to work independently. D. To provide the RBT with social opportunities. Answer. A. To make sure RBTs are following ethical guidelines and implementing procedures correctly. This question asks why RBTs need supervision. Supervision isn't just a formality. It's a crucial part of the RBT role designed to ensure quality and ethical practice. Your supervisor guides you, checks that you are implementing the behavior plans correctly, helps you troubleshoot issues, and ensures you are always working within ethical boundaries. It's about support and quality control, not working independently or just socializing. For instance, during supervision, you might discuss a client's progress and get feedback on how you are running a teaching program. Remember, supervision is there to support you and protect the client. Question 8. If a behavior decreases in the future because a stimulus was removed following the behavior, this is called A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer. D. Negative punishment. This question is about punishment. The key phrases are the behavior decreases in the future, meaning it's punishment, and a stimulus was removed, which means it's negative. So, negative punishment is when you take something away, and it makes the behavior less likely to happen again. For example, if a teenager stays out past curfew behavior and, as a result, loses phone privileges for a week, removing a stimulus, and they are less likely to stay out late in the future, that's negative punishment. Think of negative as taking away and punishment as weakening the behavior. Question 9. Which of the following best describes a task analysis? A. A way to assess what a client prefers. B. Breaking down a complex skill into smaller, manageable steps. C. A method for measuring the duration of a behavior. D. A type of prompting strategy. Answer. B. Breaking down a complex skill into smaller, manageable steps. This question is about task analysis. A task analysis is a technique used to teach skills that have multiple steps, like washing hands or getting dressed. You literally analyze the task and break it down into each individual, smaller action needed to complete it successfully. This makes teaching easier because you can teach one step at a time or prompt through the whole sequence. For instance, washing hands might be broken into steps like 1. Turn on water, 2. Wet hands, 3. Get soap, 4. Rub hands together, etc. It's all about making a big task feel smaller and more manageable. Question 10. A discriminative stimulus, SD, is a stimulus in the presence of which a particular behavior is A. Punished. B. Reinforced. C. Extinguished. D. Ignored. Answer B. Reinforced. This question defines a discriminative stimulus, often called an SD. An SD is a signal that tells you that if you do a specific behavior right now, you will get a reward. Reinforcement, it's like a green light for a specific action. For example, if you hold up a picture of a ball, the SD, and the child says ball, the behavior, and you give them a sticker, reinforcement, the picture of the ball becomes an SD for saying ball. The SD signals that reinforcement is available for a specific response. It doesn't signal punishment or extinction. Think of the SD as a go signal for getting reinforced for a specific behavior. Question 11. What is the primary purpose of collecting baseline data? A. To show the client what they need to work on. B. To determine the client's skill level or the frequency of a behavior before intervention starts. C. To see if the client likes the RBT. D. To prove that the RBT is doing their job. Answer B. To determine the client's skill level or the frequency of a behavior before intervention starts. This question asks about the purpose of baseline data. Baseline data is the information you collect before you start trying to change a behavior or teach a skill. It gives you a starting point. How often the behavior happens naturally, or how many steps of a skill the person can already do. This is super important because it lets you compare the client's progress after you start the intervention to where they were before. You can then see if the intervention is actually working. For example, if a child asks for something 5 times a day before you start teaching them to ask politely, that 5 is your baseline. Remember, baseline is your starting point before intervention. Question 12. When a previously reinforced behavior is no longer followed by a reinforcer, and the behavior decreases in frequency over time, this is called A. Punishment. B. Reinforcement. C. Extinction. D. Spontaneous recovery. Answer C. Extinction. This question describes extinction. The key is that a behavior used to get a reward, but now it doesn't, and because of that, the behavior happens less often. Punishment involves adding or taking away a stimulus to decrease behavior, but extinction is specifically about withholding the reinforcement that was previously maintaining the behavior. For example, if a child used to get attention, reinforcement, every time they whined, behavior, but you stop giving them attention when they whine, the whining should decrease over time, extinction. Spontaneous recovery is when the behavior temporarily pops back up after extinction, but extinction itself is the process of decreasing behavior by stopping reinforcement. Question 13. Prompting is a strategy used to A. Prevent challenging behavior. B. Make a behavior more likely to occur in the presence of an SD. C. Decrease the frequency of a behavior. D. Measure how long a behavior lasts. Answer. B. Make a behavior more likely to occur in the presence of an SD. This question is about prompting. Prompts are extra helps you give a client after the instruction, the SD, but before the client does the behavior, to make it more likely they will respond correctly. They are like hints or guides to help the client get the right answer or do the right thing when they are learning a new skill. Prompts are temporary and are designed to be faded away. For example, if you say, touch your nose, SD, and the client looks unsure, you might tap your own nose, a gestural prompt, to help them. Prompting helps the client succeed, making reinforcement possible and learning faster. Question 14. What is the difference between reinforcement and punishment? A. Reinforcement increases behavior. Punishment decreases behavior. B. Reinforcement involves adding something. Punishment involves taking something away. C. Reinforcement is used for good behavior. Punishment is used for bad behavior. D. Reinforcement is always positive. Punishment is always negative. Answer. A. Reinforcement increases behavior. Punishment decreases behavior. This question asks about the fundamental difference between reinforcement and punishment. The core distinction is their effect on future behavior. Reinforcement, whether positive or negative, always makes a behavior more likely to happen again. Punishment, whether positive or negative, always makes a behavior less likely to happen again. Options B, C, and E are too simplistic. Reinforcement can be negative, taking something away, and punishment can be positive, adding something. Behavior itself isn't good or bad in the technical ABA sense. It's about increasing desired behavior and decreasing challenging behavior. The main difference is the outcome. Increase vs. decrease in future behavior. Question 15. The ethical code for RBTs emphasizes the importance of A. Prioritizing the client's best interests. B. Always agreeing with your supervisor. C. Working longer hours than required. D. Keeping client information public. Answer. A. Prioritizing the client's best interests. This question is about the RBT ethical code. At the heart of ethical practice in ABA is the welfare and best interests of the client. Your actions, decisions, and interactions should always put the client's safety, dignity, and progress first. While respecting your supervisor is important, you don't have to agree blindly if something feels unethical or harmful. Working extra hours isn't an ethical requirement, and keeping client information public is a major ethical violation. Privacy is paramount. Your ethical compass should always point towards what is best for the client. Question 16. What does the term operational definition mean in ABA? A. A general description of a behavior. B. A clear, measurable, and objective description of a behavior. C. A definition that includes the cause of the behavior. D. A definition only supervisors need to understand. Answer. B. A clear, measurable, and objective description of a behavior. This question asks about an operational definition. An operational definition is like giving a behavior a specific, clear name and description, so that anyone observing it knows exactly what to look for and measure. It needs to be so clear that two different people watching the same person would agree on whether or not the behavior happened. It doesn't guess why the behavior is happening. For example, instead of saying the child had a tantrum, an operational definition might be any instance of screaming, crying, and falling to the floor that lasts for more than 10 seconds. It's about being precise and measurable so everyone is on the same page when collecting data. Question 17. When teaching a multi-step skill like washing dishes, you might teach the steps one at a time in order, providing reinforcement after the client completes the first step independently, then the first two steps independently, and so on. This method is called A. Shaping. B. Forward chaining. C. Total task chaining. D. Discrimination training. Answer. B. Forward chaining. This question describes forward chaining. Chaining is used to teach skills with multiple steps. In forward chaining, you teach the steps in their natural order. Step 1, then 1 and 2, then 1, 2, and 3, etc. You prompt the client through the steps they haven't mastered yet, but reinforce them when they complete the first step they can do independently, then the first two independently, and so on, moving forward through the chain. Total task chaining involves teaching all steps in each session. Shaping is about changing the form of a single behavior, not a sequence of steps. Forward chaining builds the skill step by step from the beginning. Question 18. Pairing yourself with reinforcement means that you A. Only give the client reinforcement if they are sitting next to you. B. Become associated with enjoyable things and activities in the client's eyes. C. Should always eat snacks when you are with the client. D. Only use edible reinforcement. Answer: B. Become associated with enjoyable things and activities in the client's eyes. This question is about pairing. Pairing is a foundational strategy where you associate yourself, the therapist, with positive, fun, and reinforcing things for the client. By consistently being the person who delivers preferred toys, activities, praise, or edible treats, you become a conditioned reinforcer. This makes the client enjoy being with you, more likely to respond to your instructions, and makes the whole learning process more positive and effective. It's not about sitting in a specific spot or only using one type of reinforcer. Think of it as becoming a fun person in the client's world. Question 19. What is an extinction burst? A. A sudden increase in the behavior when extinction is first implemented. B. The behavior immediately stopping when extinction is used. C. A new behavior that appears during extinction. D. When a behavior returns after it has been extinguished. Answer: A. A sudden increase in the behavior when extinction is first implemented. This question asks about an extinction burst, when you stop reinforcing a behavior that was previously reinforced, using extinction. It's very common for the behavior to actually get worse or happen more intensely for a little while before it starts to decrease. Think of it like trying a doorknob that won't open. You might try turning it harder or faster before giving up. This temporary increase is called an extinction burst, and it's a sign that the extinction procedure is having an effect, even though it can be challenging for a bit. The behavior stopping immediately is rare. New behaviors appearing can happen, but isn't the burst itself, and the behavior returning later is spontaneous recovery. Question 20. If a client earns a sticker for every 5 correct responses, this is an example of which type of reinforcement schedule? A. Fixed interval, FI. B. Variable interval, VI. C. Fixed ratio, FR. D. Variable ratio, VR. Answer: C. Fixed ratio, FR. This question is about reinforcement schedules. The client gets the reward sticker based on the number of responses, ratio, and that number is always the same, fixed. So it's a fixed ratio schedule. Fixed means the number or time is constant, and ratio means it's based on how many times the behavior happens. Interval schedules, phi, VI, are based on time passing. A variable ratio schedule would be if the number of responses needed for the reward changed unpredictably, like a slot machine. Here, it's a set number of responses, 5, every time, making it fixed ratio. Question 21. When you teach a client to respond differently to different stimuli, example saying car when shown a car and plane when shown a plane, you are teaching A. Generalization, B. Discrimination, C. Maintenance, D. Shaping. Answer: B. Discrimination. This question describes discrimination training. Discrimination is the opposite of generalization. It's teaching the client to respond only to the specific instruction or stimulus, the SD, and not to similar ones. You are teaching them to discriminate between different things and respond appropriately to each one. In the example, the client learns to discriminate between a car and a plane and give the correct label for each. Generalization is responding the same way to similar stimuli. Maintenance is about keeping a skill over time. Shaping is changing a single behavior's form. Discrimination is about responding differently to different things. Question 22. What is a mandatory reporting requirement for RBTs? A. Reporting any client progress to the supervisor daily. B. Reporting suspected abuse or neglect of a client. C. Reporting when you are running late for a session. D. Reporting any instance of challenging behavior. Answer: B. Reporting suspected abuse or neglect of a client. This question is about the RBT's ethical and legal responsibilities. As an RBT working with vulnerable populations, you are a mandatory reporter. This means you are legally required to report any suspicion of abuse or neglect of a client to the appropriate authorities, like Child Protective Services or Adult Protective Services, according to your state's laws and your company's policy. This is a critical ethical duty. While reporting client progress, lateness, or challenging behavior are important for your job, mandatory reporting of suspected abuse/neglect is a specific legal requirement that overrides almost everything else. When in doubt, always report your suspicion and consult with your supervisor immediately. Question 23. A consequence is A. What happens immediately before a behavior? B. What happens immediately after a behavior? C. A signal that reinforcement is available. D. The trigger for a behavior. Answer. B. What happens immediately after a behavior? This question defines a consequence, referring back to the ABCs. Antecedent, behavior, consequence. The consequence is the C and happens right after the B, the behavior. It's the outcome or result of the behavior. The consequence is what influences whether the behavior is more or less likely to happen again in the future, through reinforcement or punishment. What happens before the behavior is the antecedent. For example, if a child throws a toy, behavior, and the toy breaks, consequence, or if they ask nicely, behavior, and get a cookie, consequence. The consequence follows the behavior. Question 24. What is the purpose of naturalistic environment training? NET. A. To teach skills using strict, structured tabletop instruction only. B. To teach skills in the client's everyday environment using their interests and natural opportunities. C. To only focus on reducing challenging behaviors. D. To assess the client's IQ. Answer. B. To teach skills in the client's everyday environment using their interests and natural opportunities. This question asks about naturalistic environment training, NET. Unlike more structured or discrete trial training, DTT, which often happens at a table with specific materials, NET involves teaching skills within the client's natural routines and environment. You use their play, their interests, and everyday situations as opportunities to teach language, social skills, play skills, etc. It feels more like natural interaction and play to the client. For example, teaching a child to say ball while they are playing with a ball is NET. It's about teaching in a natural, fun, and functional way, using the environment and the client's motivation. Question 25. A graph showing the total number of times a behavior has occurred over time is called A. Bar graph. B. Scatter plot. C. Cumulative record. D. Line graph. Answer. C. Cumulative record. This question is about types of graphs used in ABA data collection. A cumulative record is specifically designed to show the total number of responses accumulated over time. The line on the graph only ever goes up or stays flat because it's adding each new instance of the behavior to the previous total. This type of graph is great for seeing the overall progress and rate of a behavior. Line graphs show changes over time, but typically don't show a running total. Bar graphs compare discrete data points. Scatter plots show the relationship between two variables. The key here is total number over time, which is the defining feature of a cumulative record. Question 26. When teaching a client to point to a picture of a dog, when you say point to dog, and they learn to do this, you are teaching a type of verbal behavior called A. Mand. B. Tact. C. Intraverbal. D. Listener responding. Answer. D. Listener responding. This question is about B. F. Skinner's analysis of verbal behavior. When the instruction is for the client to do something based on what they hear, like pointing, touching, or following a direction. This is called listener responding. You say something, and they respond by acting. A man is asking for something, example saying cookie to get a cookie. Attacked is labeling something you see or hear, example, seeing a dog and saying dog. An introverbal is responding to what someone says with words, like answering a question or filling in a blank, example, saying cat after someone says dogs. And here, the instruction is verbal, point to dog, and the response is nonverbal, pointing, fitting the definition of listener responding. Question 27. What does the term generalization mean in ABA? A. Responding the same way to different but similar stimuli. B. Responding differently to different stimuli. C. The behavior decreasing over time. D. The behavior increasing over time. Answer. A. Responding the same way to different but similar stimuli. This question defines generalization. Generalization is when a client learns a skill or behavior in one situation or with specific materials and can then perform that same skill or behavior in different places, with different people, or with slightly different materials without needing specific reteaching. For example, if a child learns to say dog when shown a picture of one specific dog, generalization would be if they also say dog when they see a different picture of a dog, a real dog, or hear the sound a dog makes. It's about the learning spreading beyond the original training situation. Discrimination is the opposite, responding differently to different things. Question 28. Which of the following is not within the RBT's scope of practice? A. Implementing behavior reduction plans. B. Conducting functional behavior assessments, FBAs. C. Collecting data on client behavior. D. Teaching new skills using prompting and reinforcement. Answer. B. Conducting functional behavior assessments, FBAs. This question asks what an RBT should not do as part of their job. Your scope of practice as an RBT is focused on implementing plans and collecting data under supervision. Conducting complex assessments like functional behavior assessments, FBAs, requires specific training and is the responsibility of the BCBA or BCABA. While you provide crucial information for the FBA by collecting data, you do not design or conduct the assessment itself. Implementing plans, collecting data, and teaching skills are all core RBT tasks. Remember, you are the implementer, not the assessor or designer of the overall plan. Question 29. When delivering reinforcement, it is important to A. Delay the reinforcement until the end of the session. B. Deliver it immediately following the desired behavior. C. Deliver it randomly, regardless of the behavior. D. Only deliver it if the client asks for it. Answer. B. Deliver it immediately following the desired behavior. This question is about the timing of reinforcement. For reinforcement to be most effective, especially when teaching new skills, it should be delivered as quickly as possible after the correct behavior occurs. This helps the client clearly understand exactly which behavior earned the reward. Waiting too long can accidentally reinforce a different behavior that happened in between, or the client might not make the connection. It's not effective to wait until later, deliver it randomly, or only give it when asked, unless asking is the target behavior. Quick delivery makes the link between the behavior and the reward clear. Question 30. If a client engages in a behavior to escape or avoid a demand or situation, the function of that behavior is likely A. Attention. B. Tangible. C. Escape/avoidance. D. Automatic. Answer. C. Escape/avoidance. This question is asking about the function of behavior. In ABA, we try to understand why a behavior is happening, what purpose it serves for the individual. One common function is escape or avoidance, meaning the person is doing the behavior to get away from something they don't like, a demand, a task, a situation, etc. If the behavior results in them successfully escaping or avoiding, that consequence reinforces the behavior, making it more likely they will do it again to get out of similar situations in the future. Attention is doing the behavior to get noticed, tangible is doing it to get an item or activity, and automatic is doing it because it feels good or meets an internal need without external consequence. If the behavior helps them get away from something unpleasant, think escape. Question 31. What is the main advantage of using positive reinforcement? A. It decreases behavior quickly without side effects. B. It makes the learning process more enjoyable and motivating for the client. C. It is the easiest procedure to implement. D. It always works for every client and every behavior. Answer: B. It makes the learning process more enjoyable and motivating for the client. This question asks about the benefits of positive reinforcement. Positive reinforcement is a cornerstone of ABA because it focuses on building desired behaviors by providing rewards the client enjoys. This makes sessions more positive, engaging, and motivating for the client, fostering a better relationship and making learning more effective and fun. While it can be powerful, it doesn't always decrease behavior. It increases it, or work quickly for everything. It also requires planning and skill, so it's not always the easiest. And no single intervention works for everyone every time. Its key strength is creating a positive and motivating environment for learning. Question 32. When using prompting, what is the goal regarding the prompts over time? A. To use stronger prompts consistently. B. To fade the prompts until the client can perform the behavior independently. C. To use as many different types of prompts as possible. D. To only use physical prompts. Answer: B. To fade the prompts until the client can perform the behavior independently. This question is about what happens to prompts as a client learns. Prompts are meant to be temporary supports. The goal is always to help the client succeed using the least intrusive prompt necessary and then gradually reduce or eliminate those prompts so the client can perform the skill just with the original instruction. The SD. This process is called fading. You don't want the client to become dependent on prompts. Using stronger prompts, many different types unnecessarily, or only physical prompts isn't the goal. The goal is independence. Fading ensures the client is responding to the instruction, not just the prompt. Question 33. What is the primary purpose of a preference assessment? A. To determine the cause of challenging behavior. B. To identify potential reinforcers for a client. C. To teach the client how to make choices. D. To measure the duration of a behavior. Answer: B. To identify potential reinforcers for a client. This question, like the example, asks about the main goal of a preference assessment. The word preference is the key clue. It means what someone likes or prefers. A preference assessment is a way to figure out what items, activities, or social interactions a client enjoys and might be willing to work for. Knowing their preferences helps you choose effective reinforcers to motivate them during learning and behavior change programs. It's not for figuring out why behaviors happen, that's an FBA, or teaching choice making, though that might be incorporated, or measuring behavior duration. It's all about finding out what motivates the client. Question 34. If a client is working on greeting others and the RBT praises them for saying hi to a peer, then later only praises them for saying hi, peer's name, and eventually only praises them for saying a full greeting like hi, peer's name, how are you? They are using the procedure called A. Chaining, B. Discrimination, C. Shaping, D. Generalization. Answer: C. Shaping. This question describes shaping. Shaping is used when you want to teach a new behavior that the client doesn't currently do at all. You start by reinforcing a behavior that is close to the desired behavior, an approximation, and then gradually reinforce only behaviors that are closer and closer to the final target behavior. You are shaping the existing behavior into the new one, step by step. In this example, the target behavior is a full greeting. The RBT starts by reinforcing saying hi, a simple approximation, and then requires increasingly more complex greetings before giving the reinforcement. Chaining is for multi-step tasks. Discrimination is responding differently to different stimuli, and generalization is doing the same behavior in different situations. Shaping is about changing the form of a single behavior by reinforcing successive approximations. Question 35. Maintaining professional boundaries with the client and their family means A. Becoming friends with the client's family on social media. B. Accepting gifts from the client or family regularly. C. Avoiding dual relationships that could impair objectivity or exploit the client. D. Discussing your personal life with the client's family. Answer: C. Avoiding dual relationships that could impair objectivity or exploit the client. This question is about professional boundaries, which are critical for ethical RBT practice. Maintaining boundaries means keeping your relationship with the client and their family strictly professional. You are there as a therapist, not a friend or a family member. Engaging in dual relationships, like being friends on social media, accepting significant gifts, or getting involved in their personal lives, can blur the lines, affect your professional judgment, and potentially harm or exploit the client or family. Your interactions should always be focused on the client's goals and therapy. Keeping a professional distance ensures you can remain objective and ethical in your work.